Greetings, this is Naomi. Welcome to my channel. My name is Naomi. I'd like to share the love that I have for you today by introducing you to one of the most despised job that earns you more than what you deserve, up to 6 figure. So allow me to introduce you to that this is CNA. Certified Nurse Assistant. For those who don't know, the abbreviation meaning of CNA is a Certified Nurse Assistant. It's an upgrade of a qualified caregiver who is able to perform more scope of practice that are being delegated to them by the licensed nurses or their supervisor. So in this course, you can work in a nursing home and help with documentation, help with patients, do their ADLs. Of course, ADLs are skills like bathing, feeding, assisting with commode, assisting with showers, and also documenting, because you know that if you don't document, it's not done. As a CNA, you can work as home health, whereby you visit residents or patients at the comfort of their homes and assist them. It's very comforting. At this point too, we see that hospitals are really looking for CNAs. Now, the one that is taking over is registries, of course. So the registries have come over and they have taken the clutch of the market by giving you a very competitive number or figure. They pay you from 30 even up to 50 an hour. I know someone's like, how? CNA is making $50 an hour? Yes, they do, baby. They do make up to 50 an hour. Do you know why? Don't forget to subscribe to my YouTube channel, because I have all the hard secrets that I will give you that will be able to bless you and help you to be able to work and make money easily at the comfort and be able to be a blessing and a provider to your family. I will not keep this to me, but I will keep sharing. Please show me the love by clicking to the subscription button and subscribe and share. Well, today, let's start back to the topic. Number one is to become a CNA. Who is a CNA? CNA is a certified nurse assistant that is certified. You have to be certified, of course. And for you to get there, you have to go to school. The program is, of course, 6 weeks, and you can choose to get this program. These programs are offered all over. You just have to make sure that you choose the school that is within your radius. Of course, a school that you can be able to drive and get there on time. Attend all your sessions and classes, which takes up to 6 weeks. After 6 weeks, you'll be required to take your exams. You can do by American Red Cross or the PSON. There you have to do a written test. Then you also have to do your skill checklist. Of course, they have to make sure that you know how to perform all the skills. So you know how to do skills like taking a manual blood pressure, repositioning a patient with left or right-sided weakness, also helping with, ADL skills that will be doing within your scope of practice as a CNM. So when you get this course, what next? It's not free. You have to pay for it. If you can get some funding, that's good for you. If you have the money, you can pay for it. But again, you can also find programs that works for your needs. For example, we have programs that you do and you are able to work. For example, weekends, you can do part-time, like evening classes. You go to work in the morning and you go for evening classes. Most evening classes are 5 to 10 p.m. If you're a night shifter, good for you. You can still get to work on time. And at night, most of the patients are sleeping. You could be catching up with your homework and doing everything that you're able to do, and you become a CNA. So once you get this paper or this certificate, let me say that, you should be able to go here. All marketers will be coming to your program to recruit you, even just before you graduate. Everybody will be coming to recruit you and telling you about the incentive that they have, all these good packages that they have for you. So you'll be so overwhelmed and excited, you'll be just waiting to finish. But one of the areas that is paying good money right now is registry. A registry, tell me, I'm an infection preventist. I work in a skilled nursing home, but trust me, the registry has taken over the industry, because this registry starts, boom, $5 more pay. So people keep shifting from one place to the other and they go for more money. Now, when you become a CNA, you choose where you want to work. You can work as a hospice care provider. That's 1-on-1 ratio. You can work in a SNF. SNF depends. The SNF is kind of very heavy. You just have to have that muscle. You must have muscles to work there. But sometimes you don't need muscle. You just need to work smart. Body ergonomics. That's what you need. Because I've seen people who are in their 70s and they are working the sniff. They're doing their job. And I'm like, dang, what do you do? They say, this is a skill. So once you get that skill, you're in good standing to work in a nursing home. It has its benefits and it has its disadvantages. As people say, the pros and the cons, it depends. Let me not forget that you are getting all that I'm trying to share out to you. Lastly, you can work in hospitals. Hospitals are in their need of CNA. They are hiring, they're recruiting massively.